Namaste, good afternoon, everyone. I'm talking about unpacking mental health and psychosocial well-being of women living with HIV in Nepal through intersectionality lenses. And I don't have my co-presenter, Dr. Narendra Thaguna, with me today. I'm joining you today from Rajshahi. It's such a beautiful place. I'm just so happy being here in Rajshahi today. He won't be able to join me today, but this is our joint co-construction knowledge that I'm going to share with you today. So the motivation and context is this presentation or this study, which was done recently in May, June, July this year in 2023, was actually initiated based on the study that I was involved in last 5 years. One is what human trafficking survivors who had been trafficked to brothels in India, and now they are back in Nepal. And they are struggling they are experiencing lots of intersectional challenges in their post-trafficking. And then based on that study, the women said that we really want to do a study with HIV in Nepal. So and then based on that study, then they found that no, our mental and psychological well-being is being in crisis, and we really want to promote our psychosocial well-being and mental health well-being. So can we do the research? And we didn't have lots of funding, so we just had a small funding, and then based on that funding, we did this study in one of the remote provinces in Nepal, which is called Sudur Pachim, far southwestern region in Nepal. And as I said earlier, this study was also based on the research that I did during the COVID-19. And then what I found that the outbreak of the COVID-19 pandemic has intensified or heightened risk for severe physical and mental health issues for people, especially immigrants and refugees living with HIV, and also women living with HIV in that areas in Nepal. So based on that study, I found that, okay, let's do the study on mental health and psychological well-being. That's the motivational part. And the research questions of that study is to explore intersectional operations experienced by women living with HIV, focusing on the COVID-19 pandemic. And also one of the goals was to critically understand the implications of COVID-19, specifically in the area of mental and psychological well-being of women living with HIV. In terms of the research methodology, I'm the participatory action research oriented person. So far, I have been doing research is all participatory action research. This is the only one research because it's a small research, so we didn't use participatory action research. It's a basically mixed methods research design we used. And in terms, so we used surveys as a questionnaire. It's not online surveys. One of my co-authors, Dr. Narendra Thaguna, he was originally from far southwestern region in Nepal. So he did go to the area and ask the question, like a questionnaire survey. He completed that. And then 100 women living with HIV in 2 different regions, they attended the surveys and qualitative study. We used focus group discussion in 2 different regions with 20 women. And obviously, it's really hard to find out the women living with HIV in that area for a number of reasons. So it's basically convenience and stop-all sampling we use. Women living with HIV living in those districts and who are 18 years and above were the communities we chose to participate in this study. As part of the theoretical framework, our intersectionality lenses we used. Intersectionality is a sociological analytical framework for understanding how groups and communities, individuals, social and political identities result in unique combination of discrimination and privileges. In that particular case study, we used how long they have been living with HIV, and then their gender-based violence experience, and also their age, and then their education, and also their caste system, how those different components impacted or escalated their vulnerability, socioeconomic, and also psychosocial and mental well-being marginalization. So that's the intersectionality lenses we used in our research. And it's just the preliminary kind of results that I'm sharing with you. So their demographic is basically non-tribal who identified Chetri. So 23 people, they belong to Chetri community, and non-tribal like a Brahmin, they were 7, non-tribal Dalit, they were 21, and Janjati 5. So what we noticed that basically Chetri people who belong to the caste system, they are identified living with HIV in the case of our study. And results of the study, as I said earlier, our goal is also to identify their mental health and psychological well-being. So in our study is still demographic part, we are still on this slide. So adolescent 1 and adults 20 to 40 people, middle age 36, mostly people who identify 36, and old age after 55. There was only 4 women who participated in our survey. And so it was not really a big, standardized kind of measurement we use. Is a ADS, widely used in the context of Nepal. It's called anxiety, depression, stress measurement. And this is our results of the anxiety, depression, stress table. So severe, basically, we can see that these slides speak to the severe level of anxiety, depression, stress is 26 people reported their anxiety, depression, and stress level is very, very high. So the results from both qualitative and quantitative paradigms, we identify that structural oppression is one of the key challenges that women are experiencing in those 2 regions. Poverty is one of the key regions that their socioeconomic marginalization are escalated, health discrimination, even when they go to hospital, and then when they have some other treatments, when they go for other treatment, and then when they identify that, oh, the woman is living with HIV, they would say, oh, I don't think you need to do surgery, or you can come back in 2 weeks because we need some more instruments for your intervention. So this is how so many women reported us that they did not have access to health services because they are living with HIV. Is so pathetic. And then employment, even though they are working, when their employers found that they are living with HIV, and then they just said that, oh, you may not be able to work in this way with us, you need some rest, even though the women are not claiming that they need rest, but that's the kind of structural, institutional kind of challenges women identify. And of course, the education was one of the big reasons they wanted to do a study, but unfortunately, there was not necessarily formal education provided by the government or provided by any non-profit organizations. They wanted to be nurse, they wanted to be a lawyer, they wanted to be accountant, but there was only unvocational or non-vocational kind of studies were provided, which was not their passion. And another region we found community oppression is loss of stigmatization they experience in their life, in their everyday daily life. They cannot go to fetch the water because, as you know, in community in rural areas in Nepal, not necessarily everyone has access to water. And then when they go to fetch water, and then people would say, oh, you are living with HIV, so you won't be you can't come when you are around the water tap. There are so many stigmatization. People don't want to sit even on a chair when a person living with HIV just sat on the chair and then she left, and then the people would say, oh, she just left on the chair, I don't want to sit on that chair. So that's loss of exclusion part that women reported in our research. And not only community oppression or structural oppression, but also family violence, family oppression. Lots of women, they got blamed by their family or husband, even though, oh, because of you, I have HIV. Their husband blamed that, but the situation was completely reversed. And then also family would say that because of you, we are stigmatized because the community does not accept us. And so women are actually, they reported they are doubly victimized. In one way, they are living with HIV, they have some other health issues because of the HIV, and at the same time, they are also experiencing lots of violence, community violence, family violence in their their life. And one interesting thing, what I found from a couple of women, not only a couple of women, some women reported that when their husband passed away, then they were exiled from their house and they did not get any property. So they were deprived of their husband's property, parental property, because of their status living with HIV. So that's the family operation women reported in our study. So what's the implications of the study then? What we found is really, really critical to carry out research on mental and psychological well-being. And I'm glad to share with you that after this research, and then we applied for a funding, and now we got a funding, and then we are currently doing a research with primarily focusing on their mental health and psychological well-being in those areas to dive in deeper to understand using different kinds of DSM standard measurement. We haven't started, we just started the first phase just 3 weeks ago. And then HIV national policies and framework in Nepal, there was not necessarily any HIV national policies and framework are in place, and the government in collaboration with HIV community organizations, they are working towards that, but it's still not necessarily in place. And however, there is a mental health and psychological well-being kind of a strategy has been developed in the context of Nepal, but it's a very much general kind of strategy, not necessarily focusing on people living with HIV. So we are actually advocating for one fits for all size model would not work, especially for the people living with HIV who are also trafficking survivors, or not necessarily they are trafficking survivors. And another implications, we found that employment and food security, they are really weak. They had hard time even to speak up when they came to our focus group discussion. So they need nutritious food, but they are living in poverty. And that's why food security initiatives should be taken by the government and also by the non-profit government community organizations is so critical. And public education around HIV, because mostly people in living not only necessarily remote areas, but also in Kathmandu, I noticed that people are not aware of how how we work with people living with HIV. They really need some more education around what HIV is, how HIV is contagious. Of course, HIV is contagious, but not necessarily if you sit on someone's chair who sat on the chair, then you can get the HIV. So there are lots of things that we need to focus on. Okay, so the conclusion, what we found based on a small study, women living with HIV experience intersectional challenges escalated by COVID-19. This was more focused on COVID-19. We had a question before COVID-19 and after COVID-19, and then COVID-19 escalate. Our study clearly speaks to the COVID-19 escalated injustice, intersectional challenges experienced by women living with HIV, and education and employment should be incorporated in mental health, national HIV policy and framework, and also mental health service counseling is important. And another key thing we found in our study that focus on maintaining confidentiality of women living with HIV. Even in a health setting, you go to a hospital and then you are admitted in the hospital, it's a big sign that HIV patient. So anyone can see or identify A, B, C, D are living with HIV. That's the system in the hospital setting. And also need more community-based studies such as photo voice, street dramas. It's really important to educate communities and educate policy makers and also enforcement people. So this is something we are currently aiming to do. Now the current research is for 3 years project, and that's one of our goals, to focus on more photo voice and street dramas. So finally, what we can claim based on this research, that women living with HIV They often experience socially produced inequalities such as stigma, hate, discrimination, racism, isolation, food security, and etc., which escalate their vulnerability to socioeconomic and mental and psychological marginalizations. So that's all. And if you would like to know a little bit more about our research, then my email address is here, and I would be happy to answer your questions if you have any. Thank you.